I'm a nurse in this community. I am a nurse practitioner in this community. I also am a nurse educator in this community. And we have talked to you, so I guess I'm trying to understand how when nurses are telling you to vote against this, when physicians, even though you're saying that that's who you're trying to support, tell you to vote against this, you as a farmer are not listening to the people that are caring for these patients. And so I don't understand how you can do that vote with a clear conscience when you don't understand. I wouldn't pretend to understand farming because that's not my specialty area. And so I would listen to what you have to say. So what I would like to know is how come you're not listening to what we have to say? The Affordable Care Act, yes, it does have holes, but it has made huge differences that I have seen in my career, and I've been a nurse for 25 years. And what we have seen that has changed is we're focusing on preventative care, which this bill now wants to cut. We were helping more with research to help new technologies to make care safer and of higher quality. We were holding hospitals accountable for higher quality. All those things are changing, and the pre-existing conditions, all of those are actually worsening. And so how are you going to support your patients within your valley? And that's what I don't understand. How are you not listening to the people who are actually caring for these people?
I am listening, and that's not just all of the teletown halls or the town halls or the mobile district office hours or even the community meetings that we hold in our offices. We do those all the time, but this under this important debate, I've gone out to the hospitals. I've gone out and talked to the nurses. I've gone out and actually asked the questions on how do you fix our overcrowded emergency rooms? How do you get doctors to actually take Medi-Cal patients? How do we get residencies in our all of our health clinics that right now today have doubled in the amount of payments from the federal government? They receive about 80% of their funding to address the needy in our community, but still can't get residencies. So there are a lot of challenges that not only have I listened, but I'm fighting to make sure that we actually have a good response in this bill.
Which one of those local professionals thinks this fixes that?
Was actually supporting increased education of physicians coverage and also nurses. It was actually covering that increased education so that we could get more providers. Yes, we were behind the gun because we had increased access, but it was actually covering those things. So in that, by changing that, you're not improving it. We were actually that way. And by cutting public health funds on top of it, we're going to increase, we're already seeing increased rates of syphilis because we keep dropping those kinds of public health conditions, public health education. So every time we're cutting things, we're actually worsening the health of our nation.